Have we any questions straight away?
I was going to turn around and say, like I was turning around saying last night, if anyone you don't know where, when you go and you've got to have your cornea thickness tested. If you go to eye opticians and they do the puff test on you, your cornea is of a different thickness, it gives them a false result. So you've got to take away 4 from the puff test result to get your true, optical pressures.
I hadn't heard
Yeah,
that.
so your general thickness of your cornea is supposed to be 500 microns or something like that. Some people can have thicker or thinner cornea, and when it's akin to kicking a thin tyre, or actually a thin tyre, the false feedback you get from it more is absorbed by the amount of tyre that's there, so to say. Because mine's thicker, when I get the feedback, I've got to take 4 away from the result,
okay.
and if it's thinner, you've got to add 4 to it. So.
Right. It's something I've not, as I say, I learn everything,
Yeah.
things all the time. It's something I haven't heard of before, but I'm guessing, I'd hope that opticians and ophthalmologists
Opticians can't, it's only the
Okay.
hospital that can measure it.
Okay. Well, there's different ways of measuring pressure actually. There's a puff test, which
It's
I'm
only
talking about.
applicable to the puff
Yeah,
test.
and then there's the other ones where you've got like direct application.
Yeah, they
Yeah.
don't work for that one.
Yeah, so
It's only the puff test.
right.
So the second type of test, the more accurate one, isn't it? That's the one we should have done, is that right?
Yeah, I mean, it is a bit more accurate,
Yeah.
but the important thing is it's not just the pressure, it's the looking at the back of the eye as well, and making sure the optic disc looks fine, and also that your peripheral vision's okay. And it's also, because everybody's different, it's not just a one-off measurement in time, it's how you're progressing. So your optician or your eye doctor will get used to what your particular eye looks like, and so it's looking for a change in your eye and your pressures rather than a one-off as well.
I think the gentleman is correct, Mr. Neugebauer, who
Oh,
looks
yes,
after
yeah.
mine, and he does the blue light
Yeah.
test instead of the puff, and he's mentioned exactly the same
Right,
thing.
okay.
The thickness of your cornea
Cornea
affects the
affects
it. Yeah.
pressure, and he has to add and subtract from the readings to
Brilliant.
get the...
Thank you very much then.
No, that's right. What we're wondering about is we have our daughter who's I've passed it on to her, she's 28. What if she starts to she gets married, she's not married at the moment, when she gets married, if she wants children, what should she be looking out for, what tests should she be, or who should she be going to, what should she be saying to her GP, who might never have heard of NPS?
Yeah. Well, the first thing is for her to get the information. I don't know whether she's had the opportunity to read up about it or talk to genetics or, get that information herself. Has she?
No.
She's not in the position yet of considering having a baby. She's doing other things.
Yeah.
We just wondered for the future, when you don't know how severe it's going to be,
Yeah.
what she should do.
So, in terms of what you should do, there's various things you should do to get your own health monitored, like we mentioned in the previous talk. So make sure her kidneys are screened once a year, and if anything's picked up, get referred to a kidney doctor. Make sure her eyes are screened. So those things for her own health. In terms of pregnancy, that's the type of thing that she should probably come and talk to a clinical geneticist about herself, to get that information and see how she feels. Because I think as long as you're fully informed, you can make your own decisions then. I think without that information, you don't know how you feel about things and you don't know which way you would go. So the best port of call would be like a referral to the local clinical genetics service, and I'm guessing you might even be on our patch if you see Mark Neugebauer.
We are, yeah.
She isn't it?
She lives in London now. So.
Okay, but there's really good regional genetic centres all over the country, and any clinical geneticist would be able to talk, about the principles of prenatal diagnosis and variability of conditions and things like that. It's sort of our standard bread and butter things. So
It might actually be worthwhile with the website getting all the, because they've got a breakdown of the areas that the clinical geneticists work by, getting a breakdown of the addresses of them and the areas they cover, to give people's doctors and stuff.
Yeah, I mean, I can certainly
Put them
send you
on
a
the
link
website,
to.
So there's that information there.
Have you got that information? Yes.
Well,
or-
we've got,
Is it attainable?
when we've, one of the later sessions, that we've now got NHS Choices website recognising Ehlers-Danlos syndrome, and there's a link on there to say that there are genetic counselling is available in each area, there is a link you can click on that tells you. So this will all have to be done through a doctor anyway, won't it, to get the referral?
Yeah, so your GP would be able to make a referral, and they would know who your local area is. So you don't have to sort of do the legwork yourself.
Yeah.
Your GP can make that referral.
Can I ask you a question about timings? One of the, obviously counselling is important, information is important, and most people here are parents, and a lot of the questions we get on the Facebook pages and direct questions to the committee are about considerations around having children, what's the percentage chances and all the rest of it. It seems to me as a logical statement that there has to be a time at which it makes sense to offer genetic counselling, i.e. giving of knowledge to people with a condition. Should people consider genetic counselling at an age? I mean, should it be at adolescence? Should it be at 20? Would you recommend? Is there a procedure you recommend?
So there's no right or wrong, but just learning from what works and hasn't worked in families generally. The best approach is from very early on to be as open as possible, and with all things sort of give the right amount of information to children at an age appropriate level in answering children's questions, because sometimes children might say, why have I got thumbs like these and things. So it's better to basically introduce things a bit at a time and answer truthfully children's sort of very basic questions. But in terms of sitting down for a thorough let's get you counselled in terms of your own sort of passing it on to other children, we often say that sort of mid-teens is a good time to think about it and to talk about it. It very much depends on your own child, your relationship with that child. Some people are very mature at that age, some people are less mature, less interested. The child has got to want to know themselves, so you can't sort of make them go and get counselled type of thing. And in terms of how soon or how late to leave it, not all pregnancies are planned, and although fathers would very much like it to be the case, not all young girls particularly plan pregnancies, and you can get surprises at sort of 16, 17, 18 and things like that. And it's always better to be in an informed position before those sort of urgent situations happen than afterwards. So I think basically if it can not be a dramatic secret at any point, introduce it truthfully and
you're not going to get away with it anyway. From my own experience, where I didn't know, when I was a kid I didn't know, obviously I didn't have the tests or nothing like that kind of thing. I noticed once or twice, if you don't know, if you're not ignorant of something, if you don't know, and it's not nothing major, as the case it were for me, you kind of question, you carry on, you're a kid, kind of thing. If you're getting dragged to and from hospitals at a young age, having tests this, that and the other, you're not going to get away with it.
Yeah,
so
that's
kids
right.
aren't going to actually have a question.
Yeah.
It's not something to bother.
Yeah, I think you're absolutely right. It depends. If you are up and down the hospital, the kids are going to want to know why they're up and down the hospital. But if you've only just
the question never comes.
Exactly.
I think the counselling is really good as well. I mean, I know from my son, 13, it's more about him knowing how to answer the questions for his friends at school, because it's kind of slipped out at school that he's got no kneecaps because someone overheard him telling a teacher because he was struggling with something, So then there was the banter about, I think there's an actual song that the kids all sing to Joe now that, about no kneecaps, and it's quite fun, he finds it funny, but he struggled with knowing how to answer questions with his friends, although he'd come to terms with it because it goes back 12 generations in our family, so it's we're very knowledgeable on the condition, and he's picked up a lot from us, but he really struggled, and it was one of the questions I was going to ask you. I've asked you about Joe's just been diagnosed with chronic Crohn's disease as well, and I know that there's, it's pretty unlikely that there's a link with nail patella, but I did want to sort of open it up. Is there anyone here that has got NPS that has got Crohn's disease as well? Because it's probably the only chance of finding out if there is anyone, because of the arthritic side of it. There's a link with arthritis with it both.
It's just, as far as in all the people that I've sort of seen, I think it's a coincidence. One of the things to be aware of, if you've got a rare condition, it's very tempting that if something else comes up, you think, oh, that must be part of Nell patella, or a couple of people have asked me about, you know, sort of like growth or things like that. Just because you've got one condition doesn't mean you can't have another. And so I would always say, if something pops up, don't just put everything down to Nell patella. Always keep an open mind and make sure that you are investigated appropriately for whatever else happens to your health. And don't let doctors presume it's all Nell patella.
I just wanted to see if there was anyone that's got it, just how they manage them both, because I know for Joe, I mean, they've referred him now for psychiatric counselling, just because he's having to deal with the Nell patella, and he's having to do lots of hospital appointments, a lot of you know, tests being done. I just wanted to find out if anyone else was going through it, just to, you know, just to chat really.
But what you say about it's not just the sort of counselling about, you know, pregnancies and things, it's about letting that young person understand their condition. I think that's really good, because especially if they have to have monitoring of kidneys and eyes, if they understand what the condition's about and they understand why, you know, it's that word empowerment, isn't it? But, you know, it helps them sort of feel more comfortable about the condition, and
well,
they
Joe
know
had
why.
PE last month, and he was doing javelin, and he had the javelin in his hand, and obviously the rotation, and he spent 20 minutes arguing with the teacher. It ended up in an argument that he ended up getting a detention for, because the teacher was saying, Joe, straighten your arm.
I've heard
So
that
that's
so
his arm
much.
straight with the javelin, and the teacher saying, Joe, straighten your arm. He's going, Miss, my arm is straight.
Well,
it's not, is it?
No. And
It
people
is, Miss.
being made to do handstands and they can't
and
do
then
it.
he's getting
Lots
told
of
that he's
being
being
shouted
cocky,
at
you know,
him.
being rude because you're answering back. And
Yeah.
and in the end, after the lesson, I think it was during detention, he actually had the chance to be able to say, I've got a condition, because it's always a problem in secondary school.
Yeah.
Primary school, we didn't have this issue, because it's one teacher through all the lessons, they're very aware of the condition. As soon as you get to secondary school, you've got multiple teachers, supply teachers coming in, and they're not so understanding. And it has been a problem. It has been a real problem.
Yeah.
But say at 13, he's able to say, I've got Nell patella, this is what it does, this is how, you know, it kind of makes the teacher feel a little bit small at the end of it, you know, which is good, you know.
The first year my son started high school, he had art class, and they all were told to sketch their own thumb.
Oh,
On the thing, sketch your own
It was
thumb.
horrendous.
He utterly, totally refused to do it and got a
I
detention
had to
for
go
it
in
as
school
well.
and
Had to
all
go in
sorts.
school because he wouldn't even show him his hands.
Oh.
And the teacher just did not understand at all. It's horrendous for him.
They all got to sit there and sketch their own thumb.
They said I'm not doing it. No. No. I think it's, with some teachers, I mean, I know it's a different subject really with teachers, but I think it's pure ignorance. Yeah.
I think throughout the whole MPS thing, the biggest struggle has been school.
Yeah.
It's the education around school and finding the right time, finding the right teachers, who's the best port of call to sit in that school and have that conversation about the condition and get that information shared.
I think
Like
it's
I
the
say,
pastoral team, isn't it? You really need to speak to the
but even
learning
with the
mentors.
passion, but yeah, we've done that. You know, the Senko's got all the information, but logistically, teachers change. There's so many of them. There's always, you know, it is always, it is really difficult.
Was there a question at the back? Sorry, did you have?
Yeah, you were going to mention, or I thought at the start you were saying about the brain and the nervous system.
Oh yeah, okay. So, in terms of the brain and the nervous system, what we know about it in Nell patella syndrome is mainly looking at where the genes expressed. So you know the little mouse embryos I showed you and seeing that it's important there. So we know that it's actually important in the way the brain develops, and also the peripheral nervous system. So that's linked with some people having sort of tingling sensations or lack of sensation. It's not completely clear how, if any, the brain is affected in Nell patella syndrome. As I say, there's some studies looking at depression and looking at ADHD. Certainly, I don't think it causes learning difficulties or anything like that, but there may be a link with the ADHD and the depression in the way a neurotransmitter called dopamine is regulated and things, so it may be a link there, but it's not completely clear.
It has actually been shown in mice that dopamine and serotonin levels ain't normal.
Yeah.
So
So
you
it's
can't
just-
test it on humans. So I was having this conversation last night. They do it from brain sizes.
Yeah. And it's difficult again to correlate. Not everything
Correlate
that
how it works.
not everything that happens in a mouse will happen in a human. And you've also got to remember that with the mice, they're lacking both copies, so they've got 2 faulty copies of LMX1B,
Right.
and humans have only got 1. So you can draw some correlations,
Right,
but not others.
Can
So-
serotonin levels be checked?
No, because it's to do with the levels in the brain. It's not levels in the blood.
Yeah, they kind of do it through sources.
Feel free. So one person was asking about blood pressure and kidneys and things in Nel Patella syndrome. So one of the regulators of your blood pressure is the kidneys, and so one of the ways that kidney function is, there's various ways of measuring kidney function. One's looking at the urine, one's looking at kidney blood tests, and another thing's measuring the blood pressure. So kidneys and blood pressure do correlate, but it's important to remember that kidneys aren't the only determinants of blood pressure problems, and that just because you've got Nel Patella syndrome doesn't mean any blood pressure problems are due to the kidney problems from Nel Patella syndrome. So just, still keep an open mind about blood pressure and the causes of blood pressure, because it might not be sort of Nel Patella kidney problems. And the second question was about knee replacements, and this goes for sort of all sort of surgery really with Nel Patella syndrome. It's a case of weighing up the pros and the cons. Sorry, is she all right? Am I being boring, sweetheart? So it's a case of discussing with your individual orthopaedic doctor who knows your case in more detail as to whether the benefits of surgery outweigh the downsides of surgery, and being aware of what that surgery is meant to be for. Is it meant to be for pain relief? Is it meant to be for increased function, increased mobility? So really having an idea of what it's for.
I had a knee replacement in January for pain relief.
Yes.
And it's been very successful.
Good.
There's a custom-made joint, because that's obviously a bit strange, aren't they?
Yeah, so that's really good. I've heard quite a lot of positive things back from knee surgery generally for sort of recurrent dislocations, so dislocations that keep happening again and again, and sort of joint replacements and knee joint replacement. It's obviously very individual from person to person. I think they tend to want to leave joint replacement till you really, really, can't stand it anymore, because the feeling is that once it's replaced, each sort of joint replacement only has a sort of certain lifespan itself, and it would need replacing again after however many. Did they sort of
about
tell
15,
you about 15 years? Yeah, so they sort of don't do it without just cause to do it. They tend to leave it until you really, really need it.
I am having the other one done, so that must be good.
Yeah.
My father had it done when he was 7, and he's now 76, and
Yeah.
he's never had a problem with it ever.
Right. Was that his whole joint replaced?
He had a rabbit bone.
Oh,
put
right,
in place.
okay. Right. So, I mean, that's different from a metal prosthesis, and, there's different types of, surgery you can have on the joint, so I don't know anything about that particular type of surgery, and I'm not an orthopaedic doctor. I'll apologise for that now.
They said to me that I'm going to need to have knees done, and obviously they've said I'm too young at the moment, so I think I'm on my fifth or sixth arthroscopy. This Tuesday I'm having it done. But they told me I've got calcification built in both my knees.
Right, so calcification's a build-up of calcium.
Is that to do with...
So I'm not sort of...
something dessicans.
Yeah, there's osteochondritis dessicans.
My son had that years ago when he was young.
So is that separate from...
So that's quite common in Nel Patella syndrome, but it can be seen in the general population. It's not just in Nel Patella syndrome. As I say, I don't want to sort of say anything wrong from an orthopaedic point of view, because it's not sort of my area of expertise, but a lot of people with Nel Patella syndrome have said been told they've got osteochondritis dessicans, and like little bits flaking off the cartilage. And
Desiccated coconut, I remember the desiccated.
Yeah.
Hi. I've got to have a new knee, and I've had a CT scan so they can make the one to fit. You said about having an MRI. Should I have one of those?
Well, I think the main thing to do is just have a word with your orthopaedic doctor and say, look, I've got Nel Patella syndrome. The anatomy is often abnormal. Are you happy with the scan pictures giving you enough of an idea about the anatomy, not just of...
My doctor's happy enough.
Yeah, so it's really, you know, I'm not here to dictate what individual surgeons should do. It's mainly to, as long as they are aware of the anatomy and what they're dealing with, that's fine. It's just, you know, without... What you wouldn't want is them just going in there thinking this is a straightforward, you know, knee replacement or a straightforward dislocation operation, something like that. You know, it's them being aware that other anatomy, not just the bones, but the muscles and the blood vessels and the nerves can be in funny places.
Between the two?
Sorry?
What's the actual difference? What's the difference between the images of a CT and MRI? What would a MRI?
So again, I'm not a radiologist, so I'm going to try not to talk rubbish here. CTs involve X-rays, so CTs are a dose of radiation, and they show up bone best.
Right, I won't show up ligament.
So they don't show them up as well as, so soft tissues are better for with an MRI scan,
Right.
but that is a
It's
real
360
broad.
degree X-ray.
Sorry?
Sort of 360 degree X-ray.
Yeah, so it's
rather than flat plane.
there's both. They both work in terms of slices,
Yeah.
and it depends on which view. So you can have slices in this plane,
Yeah.
or you can have slices in that way, or you can have slices this way. So there's 3 planes you can have slices, and sometimes they can build all those images to get a 3D model that makes it look like you've sort of...
It was a particular CT scan out trial because they couldn't do it in our local hospital. I had to go to the local Nuffield because it was a particular CT type of CT scan where I had trial.
Yeah.
What our main hospital couldn't do.
Has your surgeon actually been in your leg before then? Seen
Sorry?
your ligaments? Has your surgeon actually been in your leg before
I
the
had a
CT
CT scan before the operation.
Before the operation?
It was to make the joint because it was a custom-made joint.
So it might have
Right,
been...
yeah, that might have been to make the prosthesis.
So it might have been I'm guessing, I might be talking total rubbish here, but sometimes to make joints or to make models of things, you have a CT and then you do a 3D reconstruction. So they can make a model out of the sort of the joined up images altogether. I don't know whether
maybe
that's...
did that because it took 6 weeks for him to make it because it was about 8 weeks after the scan I had the operation.
Yeah.
Can I just talk, I've heard people talking about the labrum in the hip. It's one of the ligaments. Somebody's had it's something in America, I think, with Facebook. I just saw it. I think had a tear in it. Now, I know I'm possibly talking a bit orthopaedics again, but apparently there's now something they can do that's like an arthroscopy, but on the top of your hip where that ligament is, which I have a physio who I go see and said that's quite a new treatment. I don't know if that's something anybody's done in this country, but I know quite a lot of us get problems around, it feels like sciatic pain around your hip joint. So I just thought I'd mention that in case there's anything that comes up. I've not
You know more than me, Claire.
Yeah, well apparently it's like it's quick to get over. It's a couple of weeks on crutches. So I just thought I'd mention it because I might look at it in the future. So.
Can I ask a quick question about DLA for nail patella, specifically in children? I'm in the process at the moment because not just from we applied for it for the nail patella initially and we was refused it, but we've been advised to reapply as well because he's got this Crohn's on top of the nail patella. There's a section in it that asks for some feedback from a professional, and I'm kind of, well, what professional? Because there's the eye doctor, the kidney doctor, the bone doctor.
It is being phased
So
out though.
Do
recently.
you offer a service?
Well, I'll tell you the way DLA work.
Yeah.
And again, I'm not an expert in
It's
DLA.
being phased out. It's being phased out though, isn't it?
So with all sorts of benefits like that, you don't get the benefit because you've got sort of X condition or nail patella. It's based on what you can do or you can't do. Now, we see quite a lot of kids who there's no diagnosis for their problems, and those parents have, quite a lot of trouble getting benefits and getting help because there's no name to put in the box, but it still sort of doesn't matter. It's to do with what problems that person has and whether that affects their mobility and whether they need any extra help than somebody else of the same age. Yeah. So sort of having the actual label of nail patella won't take a box and
I mean, I get it myself. But I mean, the OTs are just about to put a shower room in downstairs for him because of the trouble with his Crohn's, and because when he gets a bad flare up, which he gets regularly, he can't even get up the stairs. Chris is still up, and you know, he's 13. Up till now, it's not been too much of a problem
Yeah.
carrying him up the stairs.
Yeah.
But at some point, that's going to be too much. He can't even get on and off the toilet when he gets a flare up. You know, it's that bad.
Yeah.
But it's
So,
filling the form
yeah.
in on the worst
So
way. You know,
what you're meant to do in terms of filling the form, it's meant to be somebody who knows that child the best and who knows what they can and can't do. So although I know a lot about Nell Patella, or a bit about Nell Patella, it's usually like a person's paediatrician, or has he got a paediatrician or community paediatrician, or
not really a general paediatrician.
No.
He sees one for his his arthritis.
Yeah.
He sees them all for individual.
so maybe, or have you spoken to your GP about it, or
That's a no-go.
or maybe talking to the doctor who, whatever it is about him that's giving him the most problems, if it's his joints giving him the most problems, get the joint doctor to fill it in. Do you see what I mean?
Yeah.
So it's the sort of the area that he's having most problems with, and the reason he needs the DLA support, if you get that particular doctor to fill it in. So it's not as a case, it's not really a case of whoever knows the most about Nell Patella, it's knowing how Joe's function is most affected, if that makes sense.
Yeah.
Okay. Hi.
Just a quick one. My wife suffers quite a lot with migraines. Has there been any sort of links towards that, or is it, like you say, it's completely separate and most people get migraines, etc.,
I haven't heard of a link with migraine, but migraine, as you say, it's quite common. Migraine can run through families, or tendency to, migraine can run through families. So I don't know whether Nell Patella's in her family, but it's possible that the same people have migraine and Nell Patella, and it can look like it's part of the Nell Patella, but as far as I'm aware, it's not. Yeah, it's not linked. Elizabeth, yeah.
I'm wondering how many other people have wrist restriction on range of motion of the wrist joint. It's never mentioned, but I could never do a handstand or a cartwheel because I can't get my wrist. And my cousin's the same, but it's never mentioned in the NPS literature or conferences.
Yeah, it's something I didn't specifically look for and sort of examine during my travels, but I know just purely anecdotally a lot of people do have that, but if people don't specifically look for it and examine for it, you won't get any figures, but I would say you weren't unusual with the Nell Patella at the time.
If the other end of the radius is dislocated, then the end at the wrist won't be in the right place either.
Yeah, so you can get some structural problems at this end of the wrist as well, but it's not unusual for people with NPS to have some problems with flexion. I mean, one thing I suppose this would be a good time to sort of apologise for. All the pictures that I showed were very much the extreme cases to illustrate things, and they are not there to frighten people. This condition isn't progressive, so if you've not got bad knee sort of bad knee malformations now, they're not going to suddenly happen, and the same with elbows. So I probably ought to have included a lot more sort of milder effects of Nell Patella. The tendency with doctors is to include the most extreme examples to illustrate a point, but I wouldn't want people to get frightened or to get the wrong message that everybody with this condition gets those extreme points. So I apologise if I've scared anybody or I've given the wrong impression about that. I have loads of pictures of very mildly affected people, but although that would be a reassurance to you, they don't tend to get included in medical presentations, so I apologise for that.
Is your slide deck, your very informative slide deck, available anywhere?
It isn't currently, but I think there's plans to have this recorded, and I can arrange for the slides to be part of that.
We haven't touched on thinness, which seems to affect everybody. I think we might have the clue to half the Western Moors problems.
There is a tendency. I think more people with NPS are on the slim side than in the general population, but not everybody with NPS. And I know very tall people with NPS, I know very chunky people with NPS, I know people who've been very overweight with NPS. But equally, I think as a tendency goes, there is a tendency for people to be on the slim side, and that's muscle bulk, but also sort of fatty tissue as well. So yeah, you do see that a lot, but not universally.
One thing that always bothered me about my condition is the base of my back. I get terrific pain in the base of my back if I'm standing up for long periods. But I think one thing that in my opinion, a lot of children need to get sorted out, as far as the parents are concerned, is the problem of dentistry. When I was a small child, I should have been referred to a specialist because I had nail patella syndrome, and it wasn't done. When you have nail patella syndrome, you tend to have overcrowding that goes on, and because of the lack of enamel that you get on your teeth because of nail patella, after so long, of course, they start to crumble and you start losing your teeth. My dad lost his when he was 20, my grandfather lost his when he was 20 as well. I'm lucky that I only started losing most of mine sort of around about the age of 40. Not so lucky in the fact that I used to be a professional jazz musician playing trombone. That didn't help. But when I went to see a specialist in Liverpool about this, to see if I could get implants done, he said he actually had the goal to turn to me and say that they only treated congenital conditions. And I'm thinking, well, if this isn't congenital, what is? Because if you inherit it from your parents, it's bound to be. And there seems to be a lack of not wanting to help in certain areas when you've got certain conditions, and unless you get it treated as a child, so that then you're not going to get that overcrowding issue, then everybody's going to end up in the same boat, you know, later on in life.
I think one of the points you raise is very, very valid in that a lot of it is a lack of information. So that person who said they only treat congenital conditions obviously didn't know about nail patella syndrome and didn't know about dental involvement in nail patella syndrome. It isn't very well known in the literature, in the medical literature. There isn't an awful lot about teeth and nail patella syndrome. In fact, until I only started asking about dental problems in the study when I noticed so many people were telling me about it spontaneously. So it wasn't something at the beginning of the study I intended to ask people about. So many people were saying, oh, I've got these terrible teeth problems. So I then started to ask everyone about it. So it won't be in the medical literature. I think I mentioned it in my paper, but there won't be an awful lot about it. So dentists probably will have never come across it, and you'll be in a position of having to tell people. Not everybody gets overcrowding, and not everyone gets the sort of the teeth enamel. So you have to take people on their own individual merits. But certainly, people who do have dental problems, it's important for their dentist to know that they have got a condition that doesn't necessarily lead to the weak enamel and crumbling teeth and things.
Yeah.
Toby wants me to ask. What happens if he was to say break a leg or his arm? Would it be best to have asked them to do an MRI scan before?
No, so I think I think it's only if sort of heroic surgery was being planned and you really needed to know, the sort of the roadmap of the muscles and the veins and the nerves and things like that. So I think if you fall off your bike, Toby, or anything like that, I think you just go to the hospital and get fixed in the normal way. Is that okay? You're planning on falling off your bike? That's a good question, though.
Part of the joint would be a good idea.
Yeah.
The joints don't heal in the normal way, straight bone does anyway.
Well, it's just important for them to know that they've got nail patella syndrome in case they see anything on X-ray and think, well, that's a bit weird. You say, well, actually, they've got a congenital condition. Yeah. Sometimes, actually, you might read in the literature that there is some evidence that the bone density in nail patella syndrome is slightly less. So, although I haven't heard about an increased frequency of fractures or breaks, If you look at a load of people with Nell patella syndrome and measure their bone density, sometimes it can be a little bit lower. That doesn't mean that everybody needs to go and get the bone density checked. It's just something to bear in mind. But that is something that often happens in ladies after the menopause anyway. So.
Hi. Sorry, you were mentioning earlier on about that with elbows and the pain, and you get a lot more pain after surgery. Are people having the surgery initially because of the pain that they're going through, or are they trying to get reconstruction and get it?
So that's a good question. There's two main reasons that people go for elbow surgery. One's pain, and one's trying to get it to straighten properly. In my experience, again, not as an orthopaedic person at all, the surgery seems to be a bit better if you're trying to treat the pain rather than trying to get the arm straight. From the people that I met who had surgery to try and get the arm straight, it wasn't successful, and some of those people had more problems afterwards than before, and they wish they hadn't had it. I certainly don't want to make sweeping, statements about all people's elbows and all surgeons and things like that, but just in my experience, people tended to be less satisfied with the surgery they'd had for elbow problems than they had for knees. A lot of people had had very successful knee surgery, either to treat a dislocating kneecap or for joint replacement and that type of thing. So elbows are just seem to be slightly less satisfactorily treated by surgery, but I would never sort of say it's rubbish, don't be operated on. I'd just say, you'd have to have a good conversation with the orthopaedic doctor and him feel confident that you would benefit from it and not cause more problems. If that sort of answers the question.
Do you find that if it's not for reconstruction, it's really more for the pain relief? Do you find that quite successful, where I don't know if they do joint injections or do you get the pain itself, rather than you accept the fact that her arms, she's got the situation with her arms, but I'm worried about when she gets a bit older and they get more painful for her, what's the best form to sort of help?
So it would really depend. It would really depend on the individual, elbow. And again, I'm not an expert at all. Some of the surgery that people have had is excision of the radial head, so cutting that malformed head of the radius, cutting that off, if that's particularly causing problems. I haven't heard of injections to joints. Injections of steroids and pain relief and things is usually to treat a sort of an inflammatory process, and it's more of a wear and tear and malalignment in Nell patella syndrome rather than an inflammation. So I don't know how helpful injection would be. I'm not saying it wouldn't, but a lot of the treatments I've heard about have actually been just to remove the radial head rather than sort of injections and things.
The only elbow surgery that I'm aware of was Carol. Have we experienced of lots of other people having it?
I haven't personally experienced anyone having an elbow joint replacement, which Carol had. I've come across lots of people, as I say, who've just had the radial head removed, and that's helped a bit. But I personally haven't come across anybody in my personal experience. I'm not saying it, other people haven't had it replaced, but I don't know enough about it to say whether it's worked better for some people rather than others. I know Carol has had a lot of trouble with hers. Yeah.
I've had both my radial heads removed with mine were dislocated.
Yeah.
My arms would lock and I'd be stuck like that for a week.
Right.
I just couldn't move. So.
Was it helpful?
Yeah, it's been really good.
Really? Oh, that's good. Excellent. And so that helped
aches and pains, but no more locking.
Okay. Yeah, so a lot of people I've spoken to have found that radial head excision, if they need it, has been helpful. Has it increased your mobility at all? I don't think it would be expected to.
No, more or less the same as they were before, it's just stopped the locking.
Yeah. And the other thing with surgery generally is if you're looking for a surgeon, and Brian's going to talk about this more afterwards, but generally it's a good idea to go to somebody who has got some concept, even if they haven't treated loads of people with Nell patella, some concept of abnormalities in the way the bones form from birth, so congenital bone abnormalities. Sometimes they're called skeletal dysplasias. So you want somebody who's used to bones that haven't formed properly, rather than just treating rugby injuries and things like that. So Brian's honed down somebody who's hopefully willing to help the general NPS community, which is absolutely fabulous. So even if you can't get somebody who knows loads of NPS, and it's very difficult to find people who've got a lot of experience of one particular condition, particularly because orthopaedic doctors tend to specialise in either knees or hips or elbows or hands and feet. They don't tend to specialise in conditions, they tend to specialise in areas. But often if they're an expert in skeletal dysplasias, they will know of, somebody who's a very good elbow surgeon or somebody who's a very good hip surgeon. So they usually have a network, even if it's not their specialist joint.
So